Today we're going to do cervical spine, range of motion, and goniometry measurements. First you're going to start with the patient seated, feet on the ground, head in a neutral position, in good posture. You're going to line up the goniometer along with the ear at a 90-degree angle with the fixed arm perpendicular to the ceiling and the movable arm along to the tip of the nose. You have the patient move through flexion. Alright. He's at 45 degrees of flexion, that's right on the dot. Then you're going to have the patient move through extension. Have the patient move through extension, keeping the same posture. He's at 40 degrees of extension, which he's within normal rhythms with both of those, with flexion at 45 degrees and extension at 45 degrees for the norms. Now we're going to do lateral flexion of the C-spine. The norm for this is 45 degrees. You're going to line up the axis with the spinal process of C7. The fixed arm is going to be along the spine in a straight line, perpendicular to the floor, and then your movable arm is going to be along with the occipital protuberance of the head. You're going to have the patient move through the range of motion. He's at 45, and you would test this bilaterally. So, and he's at 43 on that side, so both of those are within normal range of motion. Now we're going to move on to cervical rotation. You're going to have the patient seated, feet on the ground in a neutral position, and you're going to want to get above the head to help make the measurement easier. So I'm going to step in this chair. You're going to line the goniometer up with the nose, having the fixed arm perpendicular to the wall. You're going to have the patient move through the range of motion. He's at 50 degrees on the dot of normal range of motion, and that's within normal limits. And you're going to do this test bilaterally. Ready? And he's at 60 degrees for that side, so he's got a little bit more on the left side than the right. But both of those are within normal limits, and that's goniometry for the cervical spine. Now we're going to do manual muscle testing for the cervical spine. We're going to do flexion and extension, lateral flexion, and then cervical rotation. We're going to start with flexion. You're going to have the patient move through the full range of motion. Alright, so that's good. That's at least a 3. He moved it through gravity. Now we're going to have the patient push against your hand, holding him. And if he doesn't break, that's a grade 5. So he's good there. Now you're going to for extension, you're going to do the opposite. You're going to have the patient move through the full range of motion. Right? That's at least a 3. You did it against gravity. Now you're going to have pressure on the back and have the patient push against you. If he doesn't break, then he's a grade 5 out of 5. For lateral flexion, you're going to test bilaterally, so you're going to have the patient move through the full range of motion. Alright, he's good on both of those, so that's within normal limits for a grade 3. Now you're going to test further. Alright, he's got a grade 5 there, and he's got a grade 5 there, so he'd be grade 5 on both of those. For cervical rotation, we're going to have the patient move through the full range of motion. And then in order to go against gravity, we would lay him down on the table and have him go against gravity, but for the sake of the video, we're just going to go out and test for the further grades. So we're going to apply pressure to the side of the head, have the athlete push here, and then have the athlete push here. And that'd be cervical rotation, and that's manual muscle testing for the cervical spine. Now we're going to do 5 special tests that were used to diagnose cervical spine injuries. The first test we're going to start with is a brachial plexus test. You're going to have that patient seated, feet on the ground, in a neutral position. You're going to apply pressure here and pressure here to recreate the mechanism of injury. In doing this, if you have same side pain while creating an injury, you have a compression injury. If you have opposite side pain, if it hurts on the opposite side of the collision, then you would have a traction injury. The next test we're going to do is Sperling's test, or foraminal compression, or the stage 1 of Sperling's. So we're going to have the patient sitting, neutral, head in neutral position. For foraminal compression in stage 1 of Sperling's, examiner will cross their fingers, lock their fingers like this, have a slightly flexed neck, or straight down, and then apply an axial load. That's Sperling's stage 1 or foraminal compression. In stage 2, you're going to slightly flex the patient's head, the same thing, apply another axial load, and that would be stage 2 Sperling's test. For stage 3 of Sperling's test, slightly flexed, lateral flexed, and rotated. You're going to apply an axial load to the top of the head, and if any of these, that would be stage 3 Sperling's test, and if any of these result in pain, you would want to refer to MD. The next test we're going to do is the vertebral artery test. You're going to have the patient laying supine. You're going to support the neck here. Have the patient supine. You're going to extend the neck, laterally flex, and rotate. You're going to hold this and have the patient count backwards from 20.
20, 19, 18, 17.
Alrighty. So if during this switch, you can skip forward. During any of this happens, you see nystagiocism, dizziness, or the patient results in saying he's not feeling right, then you want to refer to MD, and it's possible occlusion of the vertebral artery. The next test we're going to do is called Bacotti's test or Bacotti's sign. You're going to have if the patient comes in and he's resulting in pain or saying he's having trouble up here, you're going to have him put his hand on top of his head, just like so. And if any relief of pain in that situation, could be possible that he has a herniated disc or something going on in the nerve root injury. The next test we're going to do is called the slump test. It monitors changes in pain, sequential changes while you're doing different positions throughout the body. So the first thing is you're going to have the patient seated and have them put their hands behind the back to assure a neutral spine. Then you're going to have to ask the athlete or patient to flex their neck. Alrighty, if that results in any pain, you wouldn't move on. But now you're going to have no pain resulted, so you're going to have the patient extend the knee. Alrighty. And if there's pain happens there, you would stop there. Then you have the athlete dorsiflex the ankle. You can't see it because it's behind the table, but he's dorsiflexing his ankle. And if there's no pain there, or there's pain there, then we would have the athlete bend the knee and extend and dorsiflex the ankle. And if there's still pain, then it would be a positive test. Another way to test, you'd have to test this bilaterally, of course. Then you could also extend the leg. Apply pressure at any spot along the slump test. Any positive test of that would be neural tension along the spine, and you would want to refer to a doctor for more testing.